what point does surgery become part of the conversation?
Neurosurgery is a very small component of entire epileptic gamut, and it could be indicated in not epilepsy itself is just 1% of the population, but even 1% for a population for a country like India
Is
is
huge.
huge. India, the total world population has got about 50 million, 5 crores of cases,
Okay.
of which 1 million, almost 1 crore is 10 million, 1 crore is from India.
India
So
alone.
1/5 population of epileptic patients are from India. So of these, hardly 1 or 2% may be indicated for a surgical intervention. And this surgery has developed only in last 10 to 15 years.
Okay.
Before that, there wasn't any epileptic surgery possible. So the surgery is the last resort for epileptic seizures.
Okay.
If the epilepsy is controlled by medicines, one medicine or two medicines, there is no
Okay.
indication. If the patient needs 3 or more anti-epileptic medications, these are called, or the patient doesn't get any control even after 4 medications. So that is the refractory epilepsy. In case of refractory epilepsy, epilepsy surgery is indicated.